Do your eyes ever itch so intensely that you have to stop what you're doing, and even though you know you shouldn't, you rub them anyway? Welcome back to Eye Health Insights. I'm Dr. Joseph King, and today we're diving deeper into itchy eyes, why they happen, what they usually mean, and how to calm them safely. And when itchiness is more than just seasonal irritation. Here's what we'll cover today: the most common cause of eye itchiness, how to tell allergies apart from other eye conditions, why rubbing can actually make things worse, and what practical steps you can take to prevent flare-ups. Let me start with an important distinction. In eye care, itchiness is a very specific symptom. When someone tells me their eyes burn, I think dryness. When they say their eyes ache, I think inflammation or pressure. But when they say, my eyes are incredibly itchy, allergies immediately rise to the top of the list. Itching is the hallmark sign of allergic conjunctivitis. So what's actually happening? Your eyes are exposed to the environment all day long. Tiny particles like pollen, dust mites, mold spores, and pet dander settle on the surface of the eye. In people who are sensitive, the immune system overreacts to these otherwise harmless substances. Specialized cells in the eye release histamine and other inflammatory chemicals. Histamine is what creates that intense urge to rub. It also causes redness, swelling of the eyelids, and watery discharge. Many patients also notice their allergy symptoms don't stop at the eyes. Sneezing, nasal irritation, a runny nose, it's all connected. The eyes and the nose share the same allergic pathways. There are two common patterns I see. Seasonal allergic conjunctivitis tends to flare during high pollen times, often in the spring and fall. Perennial allergic conjunctivitis occurs year-round, and it's typically triggered by indoor allergens like pets or dust. Now, let's talk about rubbing, because this is where many people unintentionally make things worse. I completely understand the instinct. When your eyes itch, rubbing feels like immediate relief, but rubbing stimulates more histamine release. So while it might feel good for a few seconds, it's actually amplifying the inflammatory cycle. Over time, aggressive or chronic eye rubbing can even weaken the cornea. In more extreme cases, persistent rubbing has been associated with keratoconus, a condition where the cornea thins and changes shape, and that affects vision, often permanently. So instead of rubbing, what can you do? Cool compresses are one of the simplest and the most effective tools. A clean, cold washcloth gently placed over closed eyelids can calm inflammation and reduce swelling. Preservative-free artificial tears can help dilute and wash allergens off the eye surface. Think of them as a gentle rinse for your eyes. Targeted allergy eye drops, especially antihistamine or combination antihistamine mast cell stabilizer drops, can both relieve symptoms and prevent further histamine release. These are very different from redness relief drops, which only constrict blood vessels temporarily, and they can sometimes worsen irritation with frequent use. Now, while allergies are the most common cause of itchy eyes, they're not the only cause. Dry eye disease can sometimes produce a mild itchy sensation, although burning is more typical when associated with dry eye. Eyelid inflammation, known as blepharitis, can cause irritation and itching along the lash line. You might notice flaking at the base of the eyelashes or crusting in the morning. Contact lenses can also contribute. Protein deposits can accumulate on lenses over time, triggering inflammation and itching. If your itchiness improves when you remove your lenses, that's an important clue. There are also less common but more severe allergic conditions, especially in children and young adults, such as vernal keratoconjunctivitis. These cases often involve intense itching, thick mucus discharge, and significant light sensitivity. These situations require specialized treatment and close monitoring. So how do you know when itchy eyes are just a nuisance versus something that needs medical evaluation? If the itchiness affects both eyes, fluctuates with seasons or environments, and improves with allergy treatment, it's likely straightforward allergic conjunctivitis. But if itching is accompanied by significant pain, blurred vision, thick yellow or green discharge, light sensitivity, or symptoms that don't respond to standard allergy drops, that's a reason to be evaluated. Those features suggest something beyond simple allergies. From a patient perspective, itchy eyes can feel surprisingly overwhelming. It's not just a mild annoyance, it can disrupt concentration at work, make it difficult to read, and even interfere with sleep. Parents often tell me their child is constantly rubbing their eyes during allergy season. Adults describe feeling fatigued by the constant irritation, and sometimes people simply have to assume that they have to live with it. The reassuring news is that most allergic eye conditions are very manageable once properly identified. Simple lifestyle adjustments can make a meaningful difference. Keeping windows closed during peak pollen days, showering after spending time outdoors, washing pillowcases frequently, and using air filtration systems can reduce allergen exposure. Small changes consistently applied can significantly calm symptoms. If your eyes are persistently itchy, resist the urge to rub and don't just power through it. A focused eye exam can confirm the cause and guide you towards targeted treatment that actually works. Itchiness is your body's way of signaling irritation. When you address the root cause instead of just reacting to the symptom, comfort improves and so does quality of life. If you're noticing ongoing eye itchiness, especially during certain seasons or in specific environments, it may be time for a tailored plan. Thanks for watching Eye Health Insights. Take care and see you soon.